situation?
Situation.
Oh. Your patient is starting in the wheelchair, and they are a right total hip replacement. Proceed.
Say it again. Right.
Right total hip
Okay.
replacement. Please transfer to the bed. Just one.
Take a second.
Yeah.
Can we do 20 seconds? Right to left.
Still go through your muscle testing. What would you assume that you would end up finding in your muscle testing?
Good strength above 3 for the left lower extremity, left upper extremity, and hopefully right upper extremity.
Yeah, very good. So you can decide if you're a 3, a 4, or a 5. Whatever he demos is what you'll roll with. Oh.
Such power.
Wow. You got control, Brandon.
How old am I?
How old am I? You're 19.
Okay, I'm not sure about one part, but I'm just gonna do it.
Just roll with it, and you are our brave volunteer. You can start with the
Wow, it's a miracle.
It's a miracle.
She used the force and commanded him.
I'm actually gonna position you so you're facing this way.
Okay.
Actually, yes. Such a good patient. Really good that one. Look, he's trying not to use his legs.
A method actor.
It's like he's done this before. So I'm gonna back this up a little bit. And I'm gonna take this off. Or should I just leave it on? Pretend that's on.
Yeah, we can pretend that you did it during the practical because you're so smart. That's one of your auto fails we already wiped out, so you're good.
Okay, so, hello, is it Mr. Joyce?
Anderson.
My apologies. Mr. Anderson.
Bond.
How are you today?
James.
Good, okay. So, I understand you're recently post-op for your right hip. You got that replaced. So, we're going to be possibly, my name is Twinkle Patel. I'm a student physical therapist at the University of St. Augustine's. Nice to meet you. So, we're going to be, if you're okay with it, I want to attempt to try to actually transfer you from your wheelchair into the bed and eventually maybe laying on your back. I want to do this because I want to, keep the positions moving so you're not, getting any like pressure sores or anything, but, also just to try to increase mobility and then maybe even get some more weight bearing into that leg as tolerated. If you're not up for it, then, there could be alternatives, so we can maybe do some sort of other exercises to help strengthen that leg to eventually transition into weight bearing, but if you're okay with it, I think the transfer would be a good idea. So, what are you thinking?
Very good.
So the transfer, we can proceed with that? Okay, that sounds good.
Yes.
All right, so I'm just gonna make sure that the wheelchair is locked first and foremost. And then I have it positioned so that your unaffected leg, your unoperated leg on the left is here, because I want that to be the leg that you may be doing primarily your weight bearing, but I'm gonna guard this right side for you. So the first thing that we're gonna do is I'm gonna have to assess your strength, and then we'll kind of go from there. So the first thing I'm going to test is some strength in your upper extremity. So we'll start off with this right side. So can you, or for both your hands, can you actually go ahead and just raise your hands up and then back down? Any pain with that? No? Okay. So next what I'm gonna have you do is I'm gonna bring your right arm up into the chicken wing, and then I'm gonna press down. You're gonna go ahead and try to resist me. Don't forget to breathe. 3, 2, 1. Relax. Okay, then I'm gonna go up. Don't forget to breathe. Try to resist. Don't let me break you. 3, 2, 1. Relax. Okay. have you kind of press your shoulder down. I'm gonna kind of grab underneath here, keep your elbow bent. I'm gonna pull up, and I want you to try to resist me, and then kind of to press that shoulder down. Ready? 3, 2, 1. And relax. Okay. Now, can you go ahead with the right side, just kind of bend your elbow, back down. Any pain with that? No pain? Okay. I'm gonna apply a little bit of resistance. So I'm gonna see what's here. Try to bend your elbow. Don't let me break you. Breathe. Okay. Now we're gonna do the same thing. I'm gonna kind of try to bend your elbow. Don't let me try to bend it. Try to breathe. Okay. Relax. All right. Now I'm gonna go ahead and test your upper extremity on the other side. We're gonna kind of go through the same thing. So go ahead and bring this up into that chicken wing. I'm gonna press down. Don't let me break you. Remember, breathe. 3, 2, 1.
I'm not feeling very strong today.
I see that. I'm gonna go ahead and go press upwards. Don't let me break you. Go ahead and breathe. Okay, a little bit there. Just a little bit. Go ahead and you're gonna bring your shoulders down. I'm gonna give upward pressure. That elbow bent. Go ahead and breathe. Relax. Go ahead and bend for this left arm, bend your elbow back. Any pain with that? Nope. I'm gonna try to extend your your elbow. Don't let me break you. Go ahead and breathe. Relax. I'm gonna do the same thing. Try to go ahead and extend your elbow. Relax. Okay. And then now we're gonna go ahead. So I'm not going to test your right side because you just had surgery on that. I don't think that would be very pleasant. But I will test your unoperated side if that's okay with you. So first thing I'm gonna have you do is I'm gonna have you kind of lift this leg right up, and I'm gonna give you downward force. Don't let me break you. Relax. Okay, pretty good. Thankfully. And then now I'm gonna apply pressure upwards, and you're gonna kind of try to get that foot on the ground. Go ahead and breathe. Relax. Now I'm gonna come right over here. I'm gonna bring your leg out here. I'm gonna apply pressure in here. I want you to try to resist me. Go ahead and breathe. Relax. Go the opposite way, so try to bend your knee. Go ahead and breathe. Relax. Okay. Oh, and one thing I forgot to test is I'm going to test your grip strength. So go ahead and grab onto my finger, squeeze them as tightly as you can. Okay, go ahead and relax. Not a good day for you. Okay, so based off that testing, that was really good. Are you okay? Do you want to take a break? Okay. So based off of that, it seems like you're pretty good with your unaffected leg, so that's great. A little bit weak on the upper extremity, and that's okay because that's what I'm here for. So we're gonna go ahead and kind of proceed with the transfer. I'm gonna kind of cue you and we'll kind of do this together. So I'm gonna put on that gate belt, make sure it's very snug. It's gonna feel a little tight, but it's gonna loosen as you kind of stand up, okay? So first thing we're gonna do is, in order to get you over here, I'm gonna want to get you scooted forward a little bit into the chair. So I'm actually going to go ahead and just kind of straighten out this leg, just so when you kind of scoot forward, I don't get your knee bending too much and maybe accidentally kind of flexing that hip. So you want to try to avoid that. What you're gonna do is you're going to lean to your right side with your head, okay? I'm gonna grab onto you because I know you're not too strong here, so I'll be there to kind of guard you. And then you're gonna lift this side, hip up, and then kind of scooch it forward, okay? So I'm gonna go ahead and, you can try to help me as much as you can. I know it's feeling a little weak, but I'm gonna kind of help you a little bit. So go ahead and lean this way, 1, 2, 3, and scooch forward. Now we're gonna go the other way, okay? So 1, 2, 3, scooch forward, good job. We're gonna go one more time, a little bit closer. 1, 2, 3. You okay? Okay, great. So now, from here, I'm going to go ahead and we're gonna do we call it a standing pivot transfer.
Okay.
So you're gonna be putting a lot of the weight on this leg. I want you to try, as tolerated, to put a little bit of weight bearing into that affected leg, but I'm gonna go ahead and kind of spot you just in case if anything happens, okay? So I'll be right here in front of you. So what we're gonna do is I'm gonna kind of give you a little bit of momentum to kind of push up.
Okay.
Do what you can with your arms to kind of get us up.
Okay.
We're gonna pivot, so you're facing me this way.
Okay.
And then we're gonna scooch back a little bit until you can feel the table on your legs, and then we're gonna take a seat. Before we start, I'm gonna bring the table a little bit higher, because you're a pretty tall individual, so I don't want you to sit down and your hip ends up being pretty flexed. So we wanna try to avoid that,
Very
okay?
smart, doctor.
I try. Okay, so I'm gonna go ahead and hold on. I'm guarding you. So we're gonna do on 3. You're gonna get up, and we're gonna try to put a little bit of weight on this side. Ready? 1, 2, 3. You okay?
Mm-hmm.
Okay. So go ahead and pivot, pivot. You're gonna slowly come back to the table, and then come back down. You okay?
Good.
Very good. Okay, so I'm going to go ahead and unlock this and just kind of move it out of the way. And then I'm just going to relock it so it doesn't roll away anywhere. And then from here, what I'm going to do is we want to get you into supine. So what we're going to do is, since this leg is pretty strong, you're going to help me out just a little bit. You're going to go ahead and slide this leg onto the table.
Okay.
And then I'm just gonna kind of hold onto this leg just a little bit to assist you, because it's feeling a little weak.
Okay.
But I'm gonna have you try to do your best to kind of get it up there on your
Okay.
own.
Very good.
And then you're gonna lay down, so your head is here, and then your feet are over on this side.
All right.
Okay? And then before we do that, we'll just take off the skate, so it's not
Sure.
uncomfortable when we're trying to take it off either. So I'm gonna help you a little bit with this leg, but try to use this leg to kind of, so on 3, 1, 2, 3, up, and down, and then I'm just gonna put my rails back up on this side, because you're already up on this side, and then go ahead and press the call light and call your nurse, because I'm done with this. How Brandon? He's like,
Awesome.
why would you?
Why would you,
That was great.
Oh,
I had to give some.
I
a little
Said Mr. Anderson, but you give off way more of a Mr. Smith vibe.
I looked at you when he asked me, and he was just like, so what do you expect? I'm like, oh, above 3 here, above 3 here, and you're just like, oh, and I was like, Brandon.
So what do you think his strength numbers were?
So it was so hard to think in the moment, but
I'm so sorry, by the
it's
way.
just, no, that's fine. It was fun actually, but definitely, to be honest, his strength in all of his extremities was below a 3 for sure. I almost had a blank moment where I was like, because if he did have full strength in his upper extremities, I would have maybe done like a lateral swing or like a slide board, depending if I would ask him, hey, have you done the slide board transfer before? No, and then I would have done that. But since he just threw a hard one on me and I kind of just had his one leg to use, we did the standing transfer.
So his leg presented
Yeah,
stronger.
his non-operated leg presented strong. The only thing I was kind of confused about when I was thinking was, I know that I had to position it so that his strong leg was near the bed, but then I guess like getting his legs on the bed, and then was I supposed to support his leg? His
You
operated
did it
leg?
correctly. So getting into the bed from the head. So if you could have brought him to the other side, and if you transferred him to his left, you would have been at the foot of the bed. But then when you were lifting his leg, you would have to reach across the bed, which would not be ideal.
Yeah.
So this is one of the considerations that we were going to get to today when you put it all together.
So I want to 80 duck his leg.
Yeah, so does that make sense? If we were here transferring to the left, you still would have transferred towards the good side, but then when you're doing the bed mobility, you're trying to support the leg, you don't want to have to reach across the table. So that's where, you're now considering a lot of, so you did it correctly, you were on that side. if she had told you it was the opposite hip replacement, you might have chosen to stay on the side, and then we would have seen that. But yeah, you are more likely to adduct the leg if you're reaching across the bed. So with the hip replacement, go in from the head, or the knee replacement. Getting out of the bed would be the opposite, but it's easier to make that decision because you are going to be on the affected side to get them out, and then by default you know where to put the wheelchair. So getting into the bed is more challenging. Based on what you guys saw, was his strength less than a 3? No, he was able to take some resistance against gravity.
So actually, I wanted to do more like a 4, and I was waiting for you to push down, and then I thought it was actually a good like moment that I think you were waiting for me to press up, and I was waiting for you to push down. And so once you didn't do that initially, I just rolled with it and I kind of made myself weaker than I normally would. Not your fault. Not your fault. No, I didn't.
What's the cue?
I didn't want to transfer. Like no
On the
plan.
count of
Just-
3, 1, 2.
Well,
Hold, don't let me
you don't
move you.
you don't need to do 1, 2, 3, but what is the cue
Hold, don't
for
let me move you.
hold, don't let me move you? So
It
you,
would break you.
I think you, like he said, you were saying, all right, press up into me, but it's hold, don't let me. So you're applying more resistance until he breaks. Also, don't say, don't let me break you. That's generally something your patients are. Why are you trying to break me, therapist? I'm supposed to help you.
I know. I broke you.
What else could have been better about the muscle testing? I know there was one group that I specifically.
The chair was really close to the bed, so I couldn't effectively do the other side.
Yes.
And I realized that afterwards, but I was
Yes.
too far.
So don't get the
Commit.
the chair set up for the transfer before you've done your muscle testing. Stay away from the bed, do your stuff, and then bring him over. Would she have passed?
Yeah.
No. Hand sanitizing.
Did not hand sanitize at all. So you touched
And
the
the bed
seat,
technically
you also
wasn't checked
didn't
to be
hand
locked.
sanitize to start. Locked the wheelchair, but did not check to make sure the bed was locked.
You did in the beginning before you started.
Or
but-
precautions
The
to
bed?
hold.
Well,
She locked
she
the
like
wheelchair.
looked around.
Yeah.
She went around when she raised the bed, but I didn't see you check
She
that
said
the
something
bed was
about
locked.
dizziness.
Would we have to verbalize it as well? Like if we're actually actively.
I would verbalize it and just to be crystal clear, because there have been times that I don't see it and
Or
then
like you looked down.
I'm kind of left like, well, you're telling me you did, but so make it very, very clear.
It's an autofill, guys, like,
Yeah.
make sure it doesn't.
And then
So,
verbalize it.
When we get into the every time you're practicing,
On the
wash
wall.
hands,
Nope, nope,
wheelchair locked, bed locked. If they're not already in the wheelchair, obviously you don't need to make sure it's locked then, because you're gonna have to unlock it to get it in position anyways. But make sure it's locked in the beginning. Also, did she explain the hip precautions?
No.
No, she kind of.
She mentioned
said
like
a
having my
little
leg a
bit.
little straighter.
Yeah, but you need to list the hip precautions and then talk about what to do to avoid them. So you got thrown off by misinterpreting his MMT scores, which is why you kind of had him lean forward a little bit. So you shouldn't have to do the head to hips. You should cue him
Oh, yeah,
to
'cause that's already.
scoot the hips forward. It's okay. He threw you through a loop with his being weird. So other points.
We don't want Mr.
I know
Anderson
at
as a
one
patient.
point we did not demonstrate compassion for. I forget what was it that she
You're
said.
just not having
You're just not.
Yeah, you're just not having a good day.
Andy, where are you?
Which is maybe fine if you're working with a patient you already have a joking relationship established with, but
Well,
first
she had that with
time
Mr. Anderson.
seeing your didn't confirm the date of
Date of
birth.
birth,
She
yeah.
did confirm the name. He just had a different name. It just worked out. It was another hip replacement.
Yeah.
Beginning, ending was fine. I think generally in the beginning you were talking, and I'm sure it was you just trying to get your bearings, which especially right now, you just came in the room and I was like, you ready? And you were like, yes. So try and not over talk everything, you know, tell your patient what they need to know. But that's when you run into risk of getting into you going over time. I think you were fine on time.
Yeah.
Bed mobility, I mean, there really wasn't a whole lot to it for this one. How were her body mechanics?
When she tested
It was just lifting the leg basically, and he laid himself down. So I think that was all fine. There really, again, there's not a lot of bed mobility you have to do for this one, but you have to remember the hip precautions and going through all of that. And then how about as far as the transfer skills went?
when his foot was in between her feet, didn't you say we shouldn't do that?
Yeah,
Like-
her foot was in between
It was
his
between
feet.
his.
Yeah.
Yeah, so we don't wanna do that.
For this patient in particular, if your foot is kind of there, that can be preventing adduction, internal rotation. So this would be the one time that's okay, but you should kind of cue your patient to externally rotate the affected leg before, because if you don't, and then you start to turn, now you're going into internal rotation. So cue that first.
How are you guarding that?
So like say you have the hip.
So if we were transferring back,
Yeah, if you're in the
Just-
wheelchair.
so if we were transferring this way, left side is good, right side's affected. I could be here, again, just to prevent those things from occurring. You're gonna lead with your hips, you're gonna use your hands. We're coming up to stand, and then I just need to make sure, yep, step out with your left, turn your right foot out first, and then step with your left, and then step back, and then go ahead and reach behind you. Generally, you don't want to have the foot in between, but this is the one scenario where if you do that, if I see you doing it, I'm going to ask why, and you should answer because I don't want her to adduct or internally rotate. Make sense?
So with the hip replacement for doing bed to wheelchair, and then we're done and they're in the wheelchair, should we put a pillow to prevent the adduction as well, and then kind of leave them in that?
In the chair? No, you don't have to. You just need to tell them not to do it. In bed, same thing. You could put a pillow between their legs, but you don't have to. So overall, you
Failed.
you did everything that you needed to, right? But just that little bit of roughness around the edges and forgetting. If it was just based on points, you would have lost some points, but you still would have passed. But the not locking the bed, the not washing the hands, the not talking about the hip recut, those are like the big things. It's very hard to fail this practical if you don't auto-fail. I remember a few, like when I first started teaching, I like added up all the points I took off this person and I was like, hold on, like, cause I thought I was about to tell them they failed and they got like an 81 and I was like, you passed, I guess, but you know, so it really focus on those points on the top and making sure safety. You should pass. You might end up, you know, with getting a lot of feedback from me or Dr. Salazar, but that's just more opportunity to learn. Okay. So Twinkle, great job.